Hey guys, welcome to my channel Healthy Positive Vibes. In today's video, we will see what is bloating, what are the causes of bloating, how to reduce bloating, and what are the treatments for this cause. Please watch this video till the end if you want to get the useful information. If you have not subscribed my channel, then please subscribe and press the bell icon to get the latest update as well as the useful information regarding health. So let's begin with this amazing video. What is bloating? Bloating is a condition where your belly feels full and tight, often due to gas. Bloating is common among both adults and children. Bloating can interfere with your ability to work and participate in social or recreational activities. Most people describe bloating as feeling full, tight, or swollen in the abdomen. Your abdomen may also be swollen, that is distended, hard, and painful. Bloating and gas are usually not signs of a serious health problem. They are tied to what and how you eat, so a few simple changes may help. It's very common and there are things you can do to ease it. Symptoms of bloating. You may be bloated if your tummy feels full or bigger than usual, you have tummy pain or discomfort, your tummy is rumbling or making noises, you're farting more than usual. Severe bloating may occur along with other serious symptoms such as blood in your stool, noticeable weight loss without trying, vaginal bleeding between your periods or if you are postmenopausal, nausea, vomiting, diarrhea, heartburn that is getting worse, fever due to an infection. If you have any of these symptoms along with bloating, call your doctor. Why do you feel bloated? Gas is the most common cause of bloating, especially after eating. Gas builds up in the digestive tract when undigested food gets broken down or when you swallow air. Everyone swallows air when they eat or drink. But some people can swallow more than others, especially if they are eating or drinking too fast, chewing gum, smoking, wearing loose dentures. Here are the common causes of bloating. Number 1. Overeating is probably the most common cause of bloating. Smaller portion should ease the pain. Number 2. Eating rich and fatty food can make you feel uncomfortably stuffed. Fat takes longer to digest than protein or carbohydrates, so it keeps the stomach full longer. Avoid bloating by limiting fats in your everyday diet. Number 3. Eating too fast adds to the risk of bloating after a meal. The remedy is simple. Eat more slowly. Satiety signals can take up to 20 minutes to reach the brain and ease your appetite. Many weight loss experts believe that eating slowly helps prevent overeating. One cause of bloating is constipation. You can be constipated and not realize it, since having fewer bowel movements than you normally do is just one symptom of constipation. You may still be constipated even if you have regular bowel movements. Other symptoms of constipation include straining to start or finish a bowel movement, stool that looks like rock and pebbles, not feeling empty after a bowel movement. Constipation can contribute to abdominal pain and bloating. The longer your stool stays in your colon, the more time bacteria have to ferment what's there, resulting in more gas and bloating. Aside from constipation, other causes of bloating include gut sensitivity. People with IBS can be extremely sensitive to gas, which can cause pain, cramping, and diarrhea. Small intestinal bacterial overgrowth. Most healthy people have relatively few bacteria in the small intestine. People who have had intestinal surgery, and or IBS with diarrhea are more likely to have small intestinal bacterial overgrowth, which can cause bloating. Gastroparesis. This condition causes delayed stomach emptying, which can cause bloating, nausea, and even bowel blockage. Some foods produce more gas than others. It can also be caused by lactose intolerance, that is, problems with dairy products. Other causes could include medical conditions such as infection, inflammation, such as condition called diverticulitis, irritable bowel syndrome, pelvic inflammatory disease, liver disease, abnormal buildup of fluid in your stomach or pelvis, Crohn's disease, blockage in your bowel or bladder, cancer, that is ovarian, uterine, colon, pancreatic, or stomach, mental health factors such as anxiety or depression, or some medicines. If you often experience bloating caused by gas, avoid these habits that make you swallow more air. Avoid chewing gum. Chewing gum can cause you to swallow extra air, which in turn can lead to bloating. Limit your intake of carbonated drinks. Avoid foods that cause gas, such as vegetables in the cabbage family, dried beans, and lentils. Eat slowly and avoid drinking through a straw. Use lactose-free dairy product if you are lactose intolerant. When to see a doctor? For temporary bloating, ask your doctor about over-the-counter medicines that relieve gas and bloating. This could include Simthicone or charcoal caps, probiotic such as some types of yogurt, and certain herbal ingredients can relieve your discomfort too. Herbal ingredients include peppermint and chamomile tea, anise, caraway, coriander, fennel, and turmeric. Consult your doctor if bloating is accompanied by any of the following: severe or prolonged abdominal pain, blood in the stools or dark, tarry looking stools, high fever, diarrhea, worsening heartburn, vomiting, unexplained weight loss. Talk to your doctor if lifestyle changes and dietary interventions don't relieve abdominal bloating. If your doctor finds a medical cause for your bloating, they may recommend medical treatments. Treatment may require antibiotics and antispasmodics or antidepressants, but it also depends on your condition. They will want to know if your bloating is occasional or if it occurs all the time. Temporary bloating is usually not serious. If it happens all the time, your doctor may order other tests. These could include an imaging test to look inside your abdomen. This could be an X-ray or CT scan. Treatments to prevent or relieve bloating. Typically, the first line of treatment for preventing gas and bloating is changing your diet. Research has shown that a low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, that is FODMAP diet, can reduce the symptoms of gas and IBS. A low FODMAP diet avoids fermentable gas-producing food ingredients such as oligosaccharides, which are found in wheat, onion, garlic, legumes, and beans. Disaccharides such as lactose in milk, yogurt, and ice cream. Monosaccharides include fructose, a type of sugar found in fruits and honey, apples, and pears. Polyols or sugar alcohols found in foods such as apricots, nectarines, plums, and cauliflower, as well as many chewing gums and candies. In people sensitive to FODMAP-rich foods, the small intestine doesn't always fully absorb these carbohydrates and instead passes them to colon, where they are fermented by bacteria and produce gas. To see if some of the FODMAP foods are causing your gas and bloating, you can start by cutting out FODMAP foods and then slowly bringing them back into your diet one at a time to pinpoint any food that are causing any problems. In the long run, the key to preventing bloating is understanding its cause. If mild constipation is the problem, a fiber-rich diet, water, and exercise may help. But these steps won't always work for chronic constipation. Chronic constipation and other conditions such as IBS or gastroparesis require medical treatment. So it's important to talk to your doctor about your bloating symptoms. In many cases, the symptoms of abdominal bloating can be diminished or even prevented by adopting a few simple lifestyle changes such as losing weight if you are overweight. Avoid bloat-inducing foods. Difficult to digest food can cause gasiness and bloating. These are some familiar culprits. Beans and lentils are very healthy foods that contain indigestible sugars called oligosaccharides. These sugars must be broken down by bacteria in the intestines. Fruits and vegetables such as Brussels sprouts, cabbage, cauliflower, carrots, prunes, and apricots. These items contain sugars and starches that may cause gasiness and bloating, even though these foods are good for you. Sweeteners can also cause gas and bloating. Sorbitol, an artificial sweetener, can't be digested. Fructose, a natural sugar added to many processed foods, is hard for many people to digest. To avoid bloating, be aware of these sweeteners in the foods you eat and limit the amount you consume. Dairy products can be a source of intestinal distress and bloating if you have trouble digesting lactose or milk sugar. Whole grains, recommended for their many health benefits, can sometimes cause bloating and gas problems. One reason whole grains are so healthy is their high fiber content. But fiber is an indigestible carbohydrate. Abruptly increasing the amount of fiber you eat can cause gas, bloating, and constipation. Nutritionists recommend slowly adding more fiber into your diet to allow your body time to adjust. Drinking liquids help fiber move through the digestive system and prevents bloating and constipation. How to reduce bloating? Do's. Exercise regularly to improve your digestion and help prevent bloating. Chew with your mouth closed to avoid swallowing air. Drink plenty of water. Eat foods high in fiber if constipated. Eat smaller, more frequent meals instead of large meals. Massage your stomach from right to left to release trapped winds. Don'ts. Do not drink lot of fizzy drink, alcohol or caffeine in coffee and tea. Do not eat lots of foods that are known to cause gas like cabbage, beans or lentils. Do not eat large meals late at night before bed or slouch when eating. Do not eat lots of processed sugary, spicy or fatty foods. Do not eat food you are intolerant to if you have a food intolerance. Summary. Fortunately, bloating is rarely a symptom of serious trouble. For most people, the most effective prescription for bloating is simple. Control portion sizes, go easy on fats, and eat slowly enough to give your body time to signal when you have had enough. These sensible remedies should keep you from feeling overstuffed and bloated. That's all for this video, guys. Hope you enjoyed this video. If you like this video, then please like, share and subscribe my channel. Thank you guys, and I will see you in the next video. Hope you always be happy and healthy.